Are you using eConsults, Maggie, to develop interim care plans? So the patient does need to go forward. Dr. Coggeshall had mentioned like a case where maybe you're doing a skin assessment and there's multiple lesions or there's things that are going on and you do need to have them go to a specialist, but it's going to be a 6-month wait. So what can we do in the interim? Are you doing those types of things? And are you seeing, like, on the flip side, that e-consultations maybe do help to expedite face-to-face after they've had the e-consult, because now the specialist is very aware that someone has weighed in? And I'm curious how that's working in your practice.
Actually, both. We've been able to utilize it for both respects. We have taken where we have a patient that's waiting to get, something will come back abnormal on a test. Just for example, with this, like even the hepatology testing or the hepatologist, we had, a patient that had some really abnormal lab work. We knew he needed to get in to see the hepatologist, but the wait was a little bit. So we sent a consult over. The hepatologist came back and said, in the meantime, order, this imaging, these extra lab tests. And then really by the time the patient went to see the specialist, everything was already ordered and done. So they needed to kind of take the lab work and the imaging results and kind of figure out the treatment plan from there. But we were able to save time because it was already done for the patient in the meantime while they were waiting.
That's a good point. And are you seeing this too with like chronic care conditions and complex conditions? Same thing?
Yes. I mean, even to get to neurology or those kind of things is really hard. But if we can get some advice on, and even sometimes it's just for us, what kind of test should I order next that would be helpful to, maybe not necessarily for my treatment plan, but when we are able to get this patient to the specialist, what would they ask for, so that we already have that imaging done or those tests run, so that they don't have to waste their time either.
Right.
They already have those things. But yes, it's greatly helpful, I think, on both ends of treating the patient. Sometimes these tests will come back negative and you're like, okay, this patient really does not need to go see the neurologist that I thought they needed to go see, because all of these tests are negative and they don't have, what we thought we were going to rule out anyway. So then we kind of go down a different route and try to figure out what is going on. But we've saved time for that patient in an unnecessary consult. And then, and sometimes it's just getting things together while they're waiting for that specialist.
That's a great point. I don't think a lot of people think about that, and I know I've done it myself as a practitioner. Sometimes you're going in a certain direction, and then the e-consult with all of the information that comes back and, hey, draw these labs, do this, starts to kind of pivot you as to, okay, maybe this is the better route to go. So that's awesome.